Yes, ma'am.
Hi, Kaylee with First Coast News. Tuesday you were here and you said when asked about ventilators coming from the federal government that you were going to have to check in on that. We know
just so if I can clarify, I was asked about respirators, which are actually different. And so and we've never really had any hospitals ask about it. What they had been asking about, which I thought related to respirators, was there was oxygen deliveries on these trucks that they thought were coming behind. So there was actually things to do the weights and measures and all that. So there was not, to this day, any request for respirators. The mechanical ventilators, we've been giving those out the whole time. And what that was it's just increasing our stockpile. And that's why they did it. So it wasn't anything that was like specifically from a hospital per se. It was something that they do through FEMA as a matter of course.
So to follow up on that, 124 ventilators are now in our area, 3 hospitals here, and they have also said healthcare workers that they need help as far as supplementing their staff and that sort of thing right now. Do you have a message about possible other resources coming to our area, and what would you say to these healthcare workers who are beyond exhausted right now?
Well, I think the staffing has been really the biggest issue that we've dealt with throughout the whole pandemic. I mean, if you recall, you saw really significant changes in how some of this is done. You've seen a lot of people go to contract, so they literally could have a job at a hospital, change jobs, work for a contracting agency, and then still do the same job at the hospital. They make a lot more money, and it's a lot more expensive to do. So there's definitely a war to try to get staff. I think it's been something that's been difficult. We have provided a lot of staff in the past for that, but our sense is that they deal with some of these agencies to try to bring people more in. That's just the situation that you're seeing all throughout the country. But there's no doubt it's not really a capacity issue as much as it is the stress on the staff, when you have higher volumes of patients. Yes, sir.
On the monoclonal antibodies, I believe President Trump used Regeneron when he had it last year. I've talked to a lot of patients that say, look, I'm interested, but I have no idea how to get it. Has this been something just for exclusive people? And why has it taken this long to get it to a point where the average citizen can maybe even start to get it?
So the answer is when President Trump did it, it was still an experimental, so it had not been emergency use. So the average person on the street in October of 2020 would not have been able to access it unless they were part of some type of trial or had different access. Once it got the emergency use authorization, it has been widely available. And so that's been done mostly through hospitals, now increasingly through doctors' offices. And I think part of the issue is have been a lot of physicians, I think Ken would agree, there's a lot of physicians that didn't necessarily know about it, and some of the physicians weren't. More and more physicians are understanding it now, and it was just a type of thing where I do think there was maybe people thought if you stress early treatment, then you were telling people that to not get back. That's not an either or. Now it's pretty clear, though, that there was not as much knowledge. So I think it's less about access, but just about knowledge, because if somebody gets infected, what they're thinking is, okay, I don't necessarily feel that bad. I know I'm at risk, but I'll just kind of ride it out. And that's what you normally would do on most illness. I totally get you. If you don't expect to go to the hospital until you start to feel really ill. But on this, if you have those risks, if you can do it early, it really makes a difference. And so the access is there. We're able to do. We can place orders for 10,000 treatments at a time, and so we're going to have. Obviously, you have staffing and stuff that you have to make sure. They're going to work here to try to make as many people go through here as possible, which will be really, really good. And the same thing as we go throughout the rest of the state. So access in terms of anybody, particularly if you're in those high-risk categories, you absolutely are eligible for it. It's just a matter of making sure that your health systems are offering it. Some clinics are doing it. And then we're now looking at saying, okay, we have some freestanding stuff that's already been going on where people have come in to get vaccinated, to get tested, whatever. Maybe we do a monoclonal and set it up in conjunction with some of those other things. So I think